I can confirm this morning that Victoria now has 1,947 confirmed cases of COVID-19 since the start of the pandemic. That is an increase of 30 cases from yesterday, so we have had 30 new cases since yesterday. At this point, with the information we know about those cases, 7 are linked to known outbreaks, 5 have been detected in hotel quarantine. 5 have been detected through routine testing, so further investigations will be ongoing for those in terms of whether they are linked to outbreaks or linked to community transmission, and 13 are under investigation. And just to reiterate that means that they may turn out to be in hotel quarantine, or they may be linked to outbreaks, or they may be cases that are linked to community transmission. So at this point in time, we have 183 active cases in Victoria, and 6 patients are in hospital, with 1 patient in intensive care at the moment. 1,742 people have recovered from COVID-19. We have received over 736,000 test results in Victoria to date, and that's an increase of 20,000 since yesterday. So we're really pleased that those test numbers are increasing, that Victorians are listening to the messages and getting tested when they're symptomatic, or getting tested in the hotspot areas where we are asking people to be tested regardless of symptoms. A couple of specific updates in terms of things that have been of note in the last couple of days. We are working closely with Coles to work through 2 cases that have worked at the distribution centre in Laverton. One of those cases is very clearly linked to a large outbreak, that is the Keilor Downs, second Keilor Downs outbreak. So we do have a very clear source of acquisition for that. Nonetheless, all of the close contacts identified are in quarantine. A further cohort of staff are in quarantine in terms of their not close contacts, but they have worked shifts with these staff members, albeit at very large distances, because it is a very large workplace, but we're taking no chances, and those staff members are literally just going to work and going home, and we are testing the entire cohort of workers because it's a very large group of workers, and we really don't want to take any chances with our essential food supplies at this point in time. Also working very closely with Coles, who already have an exceedingly comprehensive suite of infection control activities going, and they have increased those in the last 48 hours. We have a new healthcare worker who is linked to the Origin Youth Mental Health Facility and is believed to have worked whilst infectious, possibly asymptomatic, pre-symptom onset, That facility is now in lockdown. We're working very closely with Melbourne Health, who run the facility. A number of staff have been put into quarantine who've been close contacts, and obviously a number of patients are also possibly close contacts, so are in quarantine in their rooms, and full PPE is being undertaken, and obviously all of the deep cleaning requirements have been done there, and testing will be undertaken as required. Reports that there has been a case in a worker at McDonald's. I can confirm that that is the case. This person is also clearly linked to another outbreak. That outbreak is now currently being known as the Woolert outbreak. It is an outbreak linked to a number of social occasions, with some links into a school, which is St Monica's. So the St Monica's outbreak has now been renamed as the Woolert outbreak because it has become apparent that the major driver of this outbreak has been social occasions, with some spillover into the school. So the worker at McDonald's is linked to that outbreak. McDonald's again have done deep cleaning, have done a full review, and have undertaken contact tracing for all of the people who may have worked with this particular person, and all of those people are off, and I believe they are close to being able to reopen, if not already reopened. So I'll leave it at that for the major updates, but happy to take any further questions. I'd have to get back to you on that. It's the inpatient unit. Yep.
What were the social occasions with the Laverton?
I believe various household parties and gatherings.
And which McDonald's was this at, sorry?
You're testing me now. Let me check. Mill Park, correct. Mill Park.
Do you have any detail on the number of Defence Force personnel that will be used? And can you confirm that police and PSOs will be used at hotels instead of the Defence Force in some places?
Sure. So in terms of Defence Force personnel, the request that came from my area was that we needed medical staff, so either medics or medically trained staff in terms of nurses to help with our testing blitz. So that is being provided, and my understanding is that is a couple of hundred. In terms of logistics around hotel quarantine, don't have any specific announcements to be made. Obviously everybody is doing their bit to make sure all of these programs can run as smoothly as possible, and if there's any major changes, then those changes will be announced when the time comes.
Those ADF trips that you mentioned, when will they be here?
My understanding is on the weekend, that's all being organised today, and possibly tomorrow or Sunday, not sure exactly which date.
So how many ADF personnel have you requested for the testing and things like that?
At the moment, we didn't request an absolute specific number. We requested medical staff, and my understanding is that the ADF have identified at least a couple of hundred who'll be able to come down.
Have there been any more cases linked to the Coburg North family cluster or the Keilor Downs cluster, or any of those major family clusters?
Yep, so one further case has been linked to the Coburg family cluster today, and that's in a close contact who is ending their quarantine towards the end of their quarantine period. So exactly why we want to put people in quarantine. So this has been identified towards the end of that period through the testing that we undertake as part of quarantine. So that person will now obviously go into isolation, but was in quarantine at the time of testing, so hasn't created any further contacts. In terms of the Keilor Downs family outbreak, that outbreak is up to 19, so further close contacts and people known to that have been linked to that outbreak, including one of the Coles workers, as we discussed. And the large one is the North Melbourne family outbreak, which is now up to 15 cases.
How many active clusters are there in Victoria?
I don't have an exact number for you. I will have to get back to you on that. Quite a reasonable number.
Given the current climate, what's your concerns around school holidays?
So really our advice for school holidays is to be very mindful of the current restrictions and the current situation in Victoria. There's a reason we decreased the limit of people into households and the limit of people having private group gatherings to 5 and 10 respectively. So we ask Victorians to really think about whether they need to undertake frequent social events, either between extended family groups or social groups. This is the thing that is driving transmission at the moment. So we really need people to go back to that activity that they were undertaking in April and May, with physical distancing, with hand hygiene, with staying at home if you are unwell or you have symptoms, getting tested if you have symptoms, and really thinking about whether you really need to have so many gatherings, and really trying to minimise those gatherings.
People in the hotspot areas who get tested, are they required to self-isolate even if they don't have symptoms while they wait for their results?
At the moment, we don't require people who have no symptoms to self-isolate until they get results, but we absolutely require anybody who has symptoms to stay at home, both until they get results, not just until they get results, until they are completely recovered.
What's the response been over the past 24 hours with this new testing regime, ambulances going to streets, that sort of thing? What's been the general public response?
So the responses that I've heard through have been pretty universally positive. We've had a lot of people knocking on doors and speaking to people individually. We've had a lot of people having tests done at the whole range of testing sites that have been stood up in these areas, both at the end of streets, in drive-through areas, in other pop-up sites. So it has been positive, and we really hope that message continues to get out, both in terms of getting tested, but also in terms of the refocus of behaviour change that we really need the general public to take on board.
Has anyone refused to be tested?
We're not enforcing testing at this point of time, so it would be less of a refusal than a declining to be tested.
Everybody decline?
Yeah, I believe that not everybody who's been offered testing has taken up testing.
That must be disappointing.
It is disappointing. We really would like everybody to get tested in those areas. We would like to really emphasise the message that it is important to get tested. It is important for us to find every case in those areas. We understand why people might have reservations, but also we're trying to make it as absolutely easy for everybody possible to get tested.
What are the reservations? What are they saying for the reason for decline?
I'm not on the ground knocking on the doors. I think some people just don't want to be tested, but I don't have exact details about why people may be hesitant, but that's certainly intelligence that is being gathered as part of this process, which really was only stood up yesterday. So we are collecting those that sort of qualitative information around what people's hesitations are, and we'll certainly feed that back into the programs over the coming days and weeks.
Museums and tourist attractions are in time for the school holidays. Should they be allowing in Victorians from hotspots, or should they be reconsidering?
So at the moment, there are no restrictions on people from hotspots moving about the state. There's no restrictions on them entering into museums or other areas. We do have to remember we have hotspots. The overall baseline proportion of cases in Victoria is still very low. The chance that any one individual in one of these hotspots has COVID is low, but we know that those are the areas where most of our cases are concentrated. So our message is not about specific individuals from individual hotspots. It's about the behaviour of the population at large. It's about not going out if you're sick, getting tested if you are sick, and maintaining that physical distancing and that hand hygiene wherever you are, whether that's in a museum, in a restaurant, in a park, or in your house.